3, first word Leicester. 7 minutes past 7 now, and one of the things I was speaking to you about is the fact that Leicester's quite unusual when it comes to our healthcare because of the fact that we've got 3 hospitals. Now, of course, that's going to come with a cost. And so what's happening is the way in which they're ran and in order to make them more efficient, in order to make it a better experience for you, there's going to be a bit of a restructure. But what are the changes? What is the focus going to be? What is the future vision for Leicester hospitals? Now, that is what we're going to be talking about. And Tim Parker has been doing some research. He's been out and about. And at the end of September last year, the government said that £450 million was headed towards Leicester hospitals to make this big modernisation plan. So we know that's a thing. We know that the Trust wants the services to build new facilities. So we know that for sure. But there's a lot of concern about how exactly it's going to happen. This is what Tim Parker's come up with.
The public's been kept in the dark about all the details of these changes.
I don't trust the management of the NHS locally. From what I've seen, they try to keep everything quiet because they don't...
Just a couple of the protesters at a recent rally by Save Our NHS Leicestershire, a group which is trying to get local health service bosses to be more open about what they've got planned for our hospitals. Of course, everyone's welcoming the £450 million heading our way, but how it'll be spent is going to be very complicated. And we do know the basics. And they read like a great prize list.
A new maternity hospital, dedicated children's hospital at the Royal Infirmary.
Downgrading the General Hospital but making it a new stroke rehabilitation unit and primary care hub.
2 super intensive care units with 100 beds in total, almost double the current number.
A major planned care treatment centre at the Glenfield Hospital.
Modernised wards, operating theatres and imaging facilities.
And everyone's favourite,
additional car parking!
What's not to like? Well, the way it's been handled has been criticised from the start. Plans have been in the pipeline for at least 5 years. In 2017, health policy researcher at De Montfort University, Dr. Sally Ruan, said there has been an almost complete exclusion of the public from the process, despite the fact that the services at stake are used by and paid for the public. With funding now in place and the hospitals keen to get on with the work, they're in the process of getting plans approved by the national NHS, which then have to go out for public consultation. Can we see the detailed plans before they're approved? Well, apparently not, according to Tom Barker from the Save Our NHS Leicestershire group.
I think the Trust has been very evasive so far. There's a lot of other local hospital trusts around the country, such as Surrey Downs, Tyneside and Sutton, that have published the pre-consultation business case prior to going to public consultation. So all we're asking is for our Trust to do the same.
There is information online, and plenty of it, if you know where to look. But a lot of it is not necessarily easy to digest. We understand the consultations run by the clinical commissioning groups, not the hospitals, and it's due to start in March or April and last 6 weeks. Campaigners say that doesn't give everyone enough time to take it all in and give proper feedback.
We're asking that the local hospital trust will release its pre-consultation business case so the public have a good chance to look at it before the public consultation starts.
Okay, so that's a few of your views, and Tim Parker's sort of explained the situation to you. And if you have any thoughts on that, then, let me know. The free phone number to call is 0808 100 1049, or you can pop me a text on 81333, first word Leicester. What do you make to the future of our hospitals here in Leicester? Now, we've asked for someone from the local NHS to speak to us about the proposal and the concerns raised by Save Our NHS Leicester, but they've not been able to provide a spokesperson. In fact, we've actually been asking for a couple of weeks, for being completely transparent with you, but the invitation remains open to the NHS if they want to talk to us about the consultation, and we hope to look around the existing facilities soon to get a flavour of why modernisation and reorganisation is needed. And if we do have any updates on that, then we will let you know. But like I say, if you have a say and you've got an opinion on it, then do